Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please subscribe my channel and also please give your valuable comments. Friends, as we are knowing, we are discussing about the cough, clinical approach of the cough. So that portion we are dealing in very detail. So how to identify, how to diagnose and how to have a clinical approach towards a child with cough, especially infants and as well as the children. So that we are discussing since the last few days. So today we will have some of the important case discussion related to cough so that it gives an idea that how we have to approach when a particular case comes to you. And so this we will going to discuss many cases related to cough. I will start from the basics and then I will go to the complex one. So once you have a very clear cut idea of this approach, then there will not be any problem in the clinical diagnosis, and you can diagnose the case properly according to the cause and all, and then you can give the proper Ayurveda management. It is not that in all the cases we will of cough we will go for Sitopaladi Churna. It is not like that in all the cases we will go for one particular combination like Tali Sadi Churna or maybe some aristas like Vasakarishta. So these medications will going to differ from case to case. And to change the medications according to the cause, first it is very important to identify the cause of the cough. Okay, the cause of the cough, as we have seen, it may be different. It may be viral cough, it may be bacterial cough, or it may be allergic cough, it may be hyperactive airway disease, or sometimes it may be a habitual cough, or sometimes it may be some adenoids and all those things, and sometimes it may be irritative cough, or sometimes it may be because of foreign body aspiration, sometimes it may be some of the other neurological problems. So there are a number of causes of cough, and identification of this cause of the cough is important to give the proper medication in terms of Ayurveda. In all the conditions of cough, if you are only giving Sitopaladi Churna, which is commonly used, so it is not good. It's just it becomes a symptomatic treatment, and it gives only temporary relief. But to have the permanent relief to the child, first you have to identify the cause, and then only you have to give the treatment. Then only your treatment becomes successful. Anyway, so in this regard, we will see the first case. This is a case number one. So what is this case? A 2-year-old child, probably a toddler, with fever and cough came to you, and the history is for 6 days. The age of the child is 2 years, and the main complaint is a fever and as well as cough, and parents are telling that this problem is there since last 6 days. Now what the parents are telling that since last day child is also having some breathing problem. Since last day child is also having some breathing problem, and respiratory rate is now 40 per minute. And according to this history, you ask, because you should ask this question, which is the main symptom which is bothering the child now. Okay, so when you ask this question, what parents told is that since last day it was fever which was more problematic, but today onwards child is having some breathing problem that is more predominant symptom according to me. This is what mother told. So till last day it is fever which is more important, more predominant, and not the cough. And today onwards it is not even fever, not even cough, and it is breathlessness. So this asking the predominant symptom according to mother, it carries a lot of value, and it helps you to identify so many of the hidden clues. Anyway, we will see now the case. So when you see this case now, and if you see, yes, the predominant is fever. Now there is a fever in this case. So there is a infection in this case. There is no doubt, because presence of the fever is there. Okay. In some of the allergic cases also fever will be there, but fever will be very mild and it present after the cough. But this is the fever is there since first day itself. So there is no doubt there is infection. But not an airway. Why? Because there is no severe cough. According to mother, cough is not the predominant symptom. So cough is not the predominant symptom means cough is not much disturbing. So that means cough is not much severe. So that means it is not the airway disease. Okay, so cough is there, but the bigger airways are not get affected. If the bigger airways are get affected, there will be more severe cough, as we had already discussed. So but there is no airway disease because cough is not much severe. So cough is less here, fever is more. So that means this particular cough is cough of the lower respiratory tract, because we know the rule, as we go down the intensity of the cough decreases and the intensity of the breathlessness increases, and mild cough is always dangerous. So cough is not much problematic. Although cough is there, it is not much problematic, but fever is there. So that means that cough is from the lower airways, probably from the lung parenchyma. Okay, so it is now 6 day story. Now it is a 6th day of illness. So it is of acute onset. So now what happens is, child is having three important symptoms. One is cough, another one is fever, and now the child is having breathlessness. So I can assume that this particular infection started from the upper respiratory tract, gradually it descends down, and now it reaches the lung parenchyma. So till the time it reaches the lung parenchyma, cough and fever are the most important symptoms. Once it reaches the lung parenchyma, now the breathlessness start, because we know that in the lower airways the main symptom is always breathlessness. So since last day child also started with the breathlessness, that suggests that now presently infection is there, and that is present in the area of the lower respiratory tract. Okay, so it's a 6 day story. 6 day fever is there, and after 6 days also fever is not decreasing, fever is there. So usually we know that in case of viral fever, usually from the day 4 onwards the fever intensity start coming down. But here fever is there, and now along with the fever, although cough is reduced, but breathlessness is increased. So that suggests this is not a simple viral fever. This is not a simple viral fever. In case of viral fever, fever comes down by 4th day, but the fever is persistent. Okay, along with breathlessness, that means the infection has now reached the lung parenchyma, and as a symptom of lung parenchyma involvement, and there is presence of a breathlessness. Okay, so past history, if you ask, there is no much past history in this case. What is the sequence if you ask the fever? If you ask the parents about the sequence, so they says that first fever started, and then there was a mild cough, and the same scenario continued for 6 days, for 5 days. Since last day child is also having breathlessness. Now things are very clear. It is started with the fever, means it is infection. Fever is persisting up to 6 days without coming down, means it is bacterial. Okay, so it's a bacterial fever, is not coming down, it is bacterial. So it is started with the fever, that means it is not allergic. In case of allergic, first it start with the cough and then fever comes. Okay, but here the fever started first. Okay, there is no other cold symptoms, etc. Cold, running, cough, etc. is not there. What is the importance of this? Mother is telling there is no much this pharyngeal irritation and all those things, nasal symptoms, no there. Mild cough is there, fever is there, now it is breathlessness. What it suggests, we know that any of the bacterial disorders, they always cause localized infection. Viral infection, if it is there, then it always causes generalized infection. If this case would have been a viral infection, then what happened? Child have got a lot of symptoms. It would have started from the nasal area, nasal blockage, nasal secretion, rhinorrhea, then comes the oral cavity, oral irritation, then pharyngeal irritation, then comes the cough, and then the cough, and then from the cough, then there is the other symptoms. That is, you have body ache and all those things. So multiple symptoms will be there in case of viral infection. So although it started with the fever, okay, we have got two. If it is started with the fever, we have got two possibilities. Either it would have been viral or bacterial, but it is not viral because there are minimum symptoms. If bacterial only, always it causes the localized disease and there will be minimal symptoms. But in case of virus, there will be maximum symptoms. It causes generalized involvement, disseminated disease it is. Okay, so on examination, then you go for some of the examination point. In this chart, you have examine the chest. In the examination also, you have got some little congestion in the chest. Okay, so some in the right side, there is some decreased air entry in the lower lobe. So there are some chest findings are there. Chest findings are there. Now what happens? Now what is the diagnosis? Now this is not a case of viral. This is not a case of allergic. Now this is a case of a bacterial pneumonia. This is considered as acute bacterial pneumonia. Why I am telling pneumonia is a disorder of the lung parenchyma. Okay, so what indicates that this is the disease of lung parenchyma? That is that means starting of breathlessness. Once the breathlessness started, immediately you should come to a conclusion that the disease which is present in the airway previously, now it has entered into the lung parenchyma in a localized area and started presentation. Therefore, there is a breathlessness. See the sequence, fever started and then mild cough. I told as you go down, the cough will be less. As you are in upper position, is when the pathology is in the uppermost position, cough is more. So always mild cough has to be always kept under observation. So same is happening here. So this is how, so this is an acute bacterial pneumonia. So in terms of Ayurveda, if you talk, this can be considered as a Pitta Vataja Kasa, or this can be also considered under the heading of Sannipata Jora, because Sannipata Jora, it is not Taruna Jora or Nava Jora. Okay, after 7 days also or 6 days also, fever is persisting. Fever is not coming down. Fever is persisting. Now it becomes Sannipata Jora. Okay, so according to Ayurveda, when it goes to the Sannipata Jora stage, the different presentation starts. Okay, different presentations of multiple systems will go into start. Till that, it is only fever which is coming. That means that it is not localized. If it would have been viral fever, there are multiple symptoms, and you will get a clue that where we have to treat. But in this case, what happens? There is fever and mild cough. Okay, there is no localization of the disease. Localization of the disease starts after 6 months. That is 6 days. That is once the breathlessness start. So once the breathlessness start, you come to know that yes, disease is present in the lung. That is also in lung parenchyma. So that means it is causing a localized problem. Only it is affecting the one particular lobe of the lung. It is a localized problem. Definitely this is a bacterial infection. So this is how we have to identify. So same can be considered under the Ayurvedic treatment also. In Ayurveda, we can consider this as a condition of a Sannipata Jora. Previously, it have been done, that means in the first 6 days. So when you see that condition, it may look like a Pitta Vata Jora, but as it does not get relieved even after 7 days also, so that probably gives a condition towards a Sannipata Jora. Now you have to go for Sannipata Jora Chikitsa in this particular condition. So this is how we have to proceed in case of cough in children. So this is a case number 1. In the next class, we will have another important case regarding the cough. So I hope you understood it very well. That means asking the history is very important, and sequence of the symptom is also very, very important. Okay, randomly asking and randomly giving the medicine has got no value. You should have a proper diagnosis. You should have a proper cause for this particular condition, and accordingly you have to treat in Ayurveda. Now, once you know that this is Sannipata Jora, now you select the good medicines in case of Ayurveda. Okay, so whether you go for Sitapaladi Churna, whether you go for some other Vasakarishta, whether you go for Pipalyasva, now you decide according to the doshic dominance. Thank you very much. We will again meet in the next class with another case, and please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.